Good evening, YouTube. I just wanted to pop on here. I am really going to have to schedule some time to throw in women's urinary problems is what I want to talk about. But I keep wanting to get a good platform for you all that have an interest in hearing about that. So I need to set up, I want to do like a Zoom or a live setup to really dive into, can you guys see me? Talking about that. Why are you even here on my screen? Go. Nobody asked for you. You know, I hate some of these updates to things. Stuff is just like going on. I'm doing this live from my iPad, so it's like ginormous. I mean, it has me looking like this big. I was trying to do my hair, do something to it, but I was laughing, looking at myself like, you look so pretty, but it don't look pretty when you pee on yourself, you know. That's not pretty. So you've got to talk to the ladies about holistic therapies for controlling that leaky bladder that happens, especially when you get 50 and up. 50 and up, ladies, urgency, stress incontinence, urge incontinence, stress incontinence, laughing, crying, running. It can be no fun when that urine starts leaking out of that bladder, you know. That happened to me the other day. I'm telling you, it happened to me the other day. I could not make it. I waited too long. I was like, oh my God. This is so embarrassing. And it is like that for a lot of ladies. I met a ton of ladies out there that are going through this. They have the little pads that you wear. I mean, I've done visits with ladies and they said, Jenny, it's so embarrassing. It even keeps people, it can cause some additional isolation where you stay in because, you know, if you go out or you go to that event, you know, that bladder leaking, that little incontinence is going to leak out and it could be a mess. So it can be crippling to your life. And a lot of ladies, some ladies don't know what to do. They don't know that there are some of these amazing holistic remedies out there. Activating the female orgasm system is a topic of a wonderful book that goes into telling you about something called an O shot, but it is really boiling down into the best holistic, something natural that can help women with incontinence or leaky bladder and help it just amazingly get better. And it's really you helping you because we use something called PRP, which is a part of your blood. Okay, it is your amazing regenerative factors in your blood. Okay, and we inject that into the vaginal canal and then into the the clitoris cavernosum. Okay, these are ladies, these are not the men, Jenny. So they're the, okay, I gotta do my hair while I'm talking. It's dry, I gotta mousse it. And wonderful, amazing holistic results occur. There's a phenomenon that happens and it goes in there, repairs, heals that urethra area, but it ends up producing the amazing effect of no urinary leakage for at least a good, because when I got mine, I want to say 8 months, I was like able to drink over 100 ounces of water, work out, do everything. And I was like, I love that. And it takes 30 minutes. It's a 30-minute office visit. You can come in on your lunch break. I'm telling you, oh my gosh. Yes, just amazing. And a lot of women, like I say, they don't even know about it. They know about that mesh. They know about wearing diapers all the time, but they don't know that there is something holistic called an O shot that can take care of that. I mean, it's just amazing how it happens. And a lot of doctors are not trained in it, so you have to find a specialty practitioner that is trained in it, skilled, trained, certified. Okay, don't just let go and let somebody say, oh yeah, I can do that, because they cannot. Um, because when you go, and a lot of people, sometimes your doctor is quick to put you on some of the medications for urinary leakage. Okay, they will put you on your medications, and like I said, one, they don't know about getting something holistic. Two, they don't readily recommend you look for something holistic. But I'm here to tell you there is another option out here. Okay. um, I want to tell you, at the Orlando clinic, where I'll be along with a amazing practitioner. She already has this amazing thing. So those of you who know, you know, the Morpheus. For those of you who know, you know. She does amazing things with this Morpheus. It's a high-tech body treatment. It has a lot of specialties for women in it, all the way from anti-aging, of course, you know, face, neck, all of these things like there. But there are wands in there too for urinary incontinence, a holistic way. Okay, there's a wand that can contribute to tightening the canal as well. Okay, I mean, just amazing. So you can get some rejuvenation. Okay, and that's what's needed, because it's not fun. That bladder leakage is no joke. That's why Depends and those things that women buy, the little women Pampers, I mean, they probably sell in the billions of them. But there are other therapies out here that are holistic, and we love doing them. Love doing them. So I really want to schedule a big talk. Not fun. What's not fun? How do I see your comment? Let's see here. Sorry, because they're not popping up. Oh, there they are. Hi, that's amazing. Yeah, it is. My aunt works. Oh, she does. See? Didn't I just, I hadn't seen your comment. See? Didn't I say, if you know, you know? If you know, you know? Yes, yeah. So this is just making great strides. Okay, so ladies, if you guys watch this later and you want some more information, or look up Morpheus for yourself, you guys, do a little research for yourself. Look up Morpheus and all of the benefits that you can get done with Morpheus. That's amazing. Then of course, the amazing ability, ladies and gentlemen, to get re-regulated with pellet therapy, with hormone pellet therapy. For men, a little tiny pellet of testosterone just revives lives. For ladies, a little tiny pellet of testosterone revives lives, re-kicks back in some normalcy to your life. Everything from weight loss, libido, bone health for men, just getting your levels back to where you are living again. No more fatigue, irritability, low, like I said, low libido. Like, I ain't even thinking about that. No, you should be thinking about it all the time. Well, not all the time, but you know what I mean. For men, I mean, men do not even realize, especially men, I want to say 50 and up, but for men it can be 40 and up, depending on your lifestyle. Okay, you carrying all that weight, you carrying diabetes and your other two cousins, hypertension and high cholesterol, along with you. Yeah, you guys need some definitely revitalization. So checking you guys' hormones levels. I mean, it's amazing what a little testosterone gel can do. Okay, get rid of all that fatigue, your mood swings, your general decline in some health, feeling burnt out all the time. How can it feel to feel vibrant again, to feel just back some normalcy? So that's what we're doing. Even hair loss, even up to hair loss, hormone replacement can help with hair loss. Okay, your own body's PRV can help with hair loss. So there are just so many things. Like I say, androgen deficiency. A lot of men have androgen deficiency, and you just don't realize how just a little dose of testosterone will help bring things back to your wonderful self, your wonderful life. So yeah, but definitely for the ladies, if incontinence is your thing, if it is bothersome for you, if it's keeping you in the house, or you're like, oh my God, I couldn't make it to the door again, and you gotta change. Sorry, I need to come in. And you gotta change clothes, and the odor. Oh my God, been there, done that. Like, oh, this is so embarrassing. I couldn't hold it. So yeah, like I say, especially 50 and up, it's just an issue. And I hate when ladies tell me, oh my God, Jenny, I don't even go anywhere anymore. It can be that debilitating where I don't even go, only to the essential places and not any other enjoyable activities, because you don't want to pee on yourself. You don't want to have fun. You're laughing, enjoying yourself, and then you got to pee on yourself. That little leakage starts, and you can't make it to the bathroom. Oh my God. I wish, I just need a crowd of ladies that have experienced these things, because it's not funny, but it's funny sometimes, and like posting that video, if you guys saw my video about, bladder problems matter. Like those ladies there, even though they were drunk, and that contributed to their bladder being full and weak, and, all the extra things, still, with a normal good bladder, even if you've drank something, you can get to the door and get in. But that represents what happens in a normal sense, in a normal way, to many ladies every day. That's the norm. They don't have to be drunk or drinking for that to happen, because it does. All right, we're about to do this hair, something else. Okay. Yeah. And it's no fun. Like I said, it can be embarrassing. Oh my God. One day I was going in, where was I going? I was going to check in. A friend of mine had invited me to, where was she at? The Hard Rock, I think. Yeah. And I was going into the Hard Rock, and this man just was kind of enamored with my looks or whatever. I was just talking to me, and I'm sitting there thinking, I gotta go to the bathroom, I gotta go to my room, but he's being nice, and I'm trying to be nice. And I'm feeling like, okay, I gotta go. I cannot, if I didn't have to go to the bathroom, I would have wanted to stay there and chat a little bit more. I'm super friendly. I love chatting to people. But I had to go. And he was like, because I said, I got to go upstairs and change. And then I can be back down, because I'm just checking in, right? And he's like, no, you look fine. And I'm thinking, no, because his pee is leaking out of me, and I'm about to be stinky really fast, right? And I took off. I never did go back and find that man and talk to him anymore. But I ran up to the room. By the time I got off the elevator upstairs, it was like coming out. By the time I got to the door, I was fumbling trying to use the key. Okay, and that was no fun. By the time I got in there, I had to shower and change, So, yeah. So I love natural things that can work for it, for conditions. So getting an O shot or a clitoral PRP is amazing. And then, ladies, one, I don't want to call it a side effect of it, but some ladies actually, and my colleague told me, she has some ladies that come in and okay, I want to make sure it's ladies on here that I'm talking to. How can I tell who's on here? Or nobody's on here? Maybe nobody's here, Jenny. Okay, but the ladies, wait, where's my libido thing? Okay, ladies, the other thing that the clitoral shot or O shot does is it really enhances your ability, your pleasure abilities. It like triples it, like times 10. So some ladies actually come into the office, and this 30 minutes is real fast. You can run in on your lunch break, and they do. Ladies come in and they get the PRP clitoral shot or the O shot just for the libido enhancement. They don't get it. Some of the younger girls, the 25s to 35s that have no bladder issue for whatever reason, they just want the pleasure enhancement, which I can't see why. Like, you would think you're, that's the age where you're just, at your height. But some ladies come in for that because there are ladies that need that boosted too. So that's another natural way to boost that. So when you get it for your urinary incontinence, you get like a twofer. You get your urinary leakage stopped, and you get your pleasure enhancement. Definitely. I mean, it goes like that. Like if you were a one-timer, you're now a 10-timer. So just focus on the urinary leakage part and it clearing up and helping with that so much. But yeah, it's amazing. It's just amazing. 30 minutes in the nope, we're not. I'm tired of these. I'm tired. Okay, I'm tired of these. So yeah, so that's that. So if ladies, if you guys watch, okay, those are just some additives I added on. If you guys watch this and want more information, please reach out, or someone, because I've ran into ladies and a lot of them did not even know there's something else holistic besides those freaking medications for urinary incontinence for ladies. They was like, Jenny, I had no idea. I've never even heard of that. Yep. Yes. A 30-minute visit and no more leakage for at least 6 to 8 months. And that's like a treasure for some people. That is like a treasure. I'm telling you. I was like, wow, this is freaking amazing. Like, I'm always saying amazing, my Luther song. So amazing. That's how I felt. I was like, especially when I could drink over 100 ounces of water and still go gym and work out, like in the sauna and do my stuff. I was like, I love this, God. You are amazing. The body has an amazing ability to heal itself. Woo! I'm sweaty. But yeah, so it's amazing. So please reach out and just get some information on it. Just get a little information on it, because it's amazing. Because urinary incontinence, it's no joke. Bladder problems are no joke. Many women have that. Many women have urinary leakage, be it stress, be it urge. Yeah. So there are natural things out there that work with it. And like I said, 30 minutes in the office, ooh, and you're out. So I thought that was interesting that my colleague, she says, oh, Jimmy, I've only done, she's never done it for the urinary incontinence, and I've never done it just for intimate pleasure. So I said, no, everybody I've done it on has always been urinary incontinence. She said, oh, I've only had girls Maybe that's an Orlando thing. They've only came in to boost up the pleasure zone. I'm like, wow, okay. And they be younger ones. I was like, okay. I like my older ladies. I do. I like my older ladies. I mean, I like my young ones too. I like y'all. I love y'all. I love all of y'all. But I'm saying, I like the issues and the problems that us older ladies have. Because it's special. We're in a special group, and we want to do stuff so that all of you younger ones get to that same point as well. So yeah. So that's my spiel on Morpheus, hormone therapy. Hormone therapy replacement is just, it's still vital too. And I don't still know why a lot of providers these days, they're not running y'all hormones. So if you need your hormone labs run, reach out, let me know that too. Let me order them for you, go get them done, and let's make some adjustments. Some people, I'm telling you, adjusting your hormone levels, tweaking it just a little bit, just it's a healthy thing. It is. Look how happy they look. You see that? I mean, that's how you feel. That is how you feel. That's how you feel. And I miss doing this procedure. I was just looking at Dr. Lee, the pimple popper, if anybody's ever watched that. And my heart, like, you know, this is why I'll be so glad to be back in and get a clinic facility to do some of these amazing procedures, because I miss doing them. I haven't held a scalpel in a while. I miss scalpel procedures. But I love what I'm doing now with the restorative circulation too. So, but I miss some more of the restorative circulation is a amazing, also again, another natural therapy that helps restore circulation for those who have poor circulation. If you're on medications, you have any underlying conditions, accident, injury, so many things can lead to your poor circulation. And it's vital that it improve, because it's just a downward spiral. It is. Poor circulation, you're not getting nothing to the levels that you should everywhere in your body, every system, every organ. So circulation is so important. Okay, that's why I'm still drinking my detox. Still, this is my apple cider vinegar. My apple cider vinegar, cayenne pepper, okay. My natural Red Bull. I'll tell you, I'm gonna be drinking this all day because I am detoxing my body. So, so this is apple cider vinegar, cinnamon, cayenne pepper, a dash of honey, lemon. Okay. All right. And y'all know I'm firming up this belly. But anyway, so circulation is very amazingly important for everyone, even up to the brain. Okay, up to the brain. You need. So many people have poor circulation. They do poor circulation, and it's leading to so much, and it's a decline in your body and your system. So I love doing restorative circulation. Dang, I feel like I should just sit here and start from the beginning of who the heck I am. But I like doing restorative circulation, but it's simple. It's so simple. It's very simple. I miss my scalpel procedures like that, you know. So, but it'll be back because you guys are going to be coming in for these pellets. Somebody's going to want some. They're going to be like, yes, Jenny, I didn't even know you did that. Yep. I don't just do circulation. That's my mainstay thing right now that I love, because so many people need it. There's so many people out here that need healing. There's sores. Oh my gosh. You guys, especially men. You only had one height. Especially men. My men. You guys. Whew. Y'all are really, really, really in my heart for needing help. Oh, good. I thought thought you were getting antibiotics. Exosomes. I mean, if you know, you know. Getting exosomes. There are people getting next level things out here as far as regenerative medicine goes. And if you think you are a candidate for it and that's something you want to look up, I highly advise it. You got dementia, Alzheimer's, you know, all of these things going on. Look up some of these next level therapies and treatments, including exosomes. Okay, because if you know, you know. I'm telling you, because people are getting them. Okay, ask them athletes, they like getting them. Ask they're getting them, but I don't want to say regular people, but everybody can have access to some things that they don't know that they can have access to. Let me show you guys. I just want to share. This came through to me, a friend of a friend, you know. I just love everybody, right? And people, Janie, can you talk to somebody and they got a friend that got a sore? Can you look at it, you know? And I'm so nice. I'll always be like, yes. Tell them to give me a call, right? But look what came through. And this is why I'm saying, you guys, y'all got to take care of yourselves. Where is that? Cause I'm just, what the heck? Where is it at? Oh. Okay. Any feeble eyes out there, if you guys have, like, if you're squeamish, because I just want to share this picture with you guys. Because I can't believe that you got to change your insides. You have to work on your insides. You have to work on your insides. Okay, I'm going to share a picture. Okay, there's no face in here, but it's just a hand. And if you, can you see that? Okay, let me go right there. So a friend of mine says, Jenny, look, this is going on with my friend. These growths are all over the hand. I think they're, yeah, the hand, because the feet aren't there. And what should she do? I said, first of all, and this is a diabetic. This is a diabetic. So y'all playing around with them blood sugars out there. Stop. I gotta sip some apple cider vinegar for y'all. Y'all just stop it. Stop. You have to like apple cider vinegar to drink that. There ain't no joke. But okay, do you guys see that? So you see what's going on. There's sores there, they're there. And the other pictures, ooh, wow, that did not. Please tell me that did not fall. Jesus, we can't be getting no strikes. We're just here. Hold on, y'all. I gotta make sure. Because one of my little strings on this dress came off earlier. So it made it a little loose in the back, but we're not gonna be falling. We old fashioned. We can use our bobby pin for everything. I'm black. We can use a bobby pin for everything. Okay, hold on. But that person is a diabetic. And I said, first of all, immediately, she got to change her insides. I don't know what she's eating. No, yes, I do. I can look at that and tell what she's eating. She's not staying within her diabetic diet. And that's what they told me. I said, first, she's got to clean out her insides ASAP. She will lose that hand. She is on her way to losing her hand if some changes aren't made. Take her into the urgent care doctor's office, because I said, how did it get this bad? It was small before it got that bad. But unfortunately, in her particular case, the caregivers there was some neglect going on, and so the caregivers did not pay attention. And she's blind. Not only is she diabetic, but she's blind. And I was like, couldn't she feel the growth and things going on? Was she trying to tell them? But even if she was feeling that, it could have been the case where they didn't pay it attention. And so now she's not in that neglectful situation anymore. But I said she needs to get that seen immediately. Immediately, she will lose that hand. It's already blackening. She will lose, she's on the way to losing that hand. And some of you out there are on the way to losing limbs as well. You are. Those sores are coming on. You're not hydrating properly. You're dry. You got that dry skin. Those, especially men, those dry feet. Men, y'all in those dry feet. Being a diabetic and on medication. So we just, you got to get better. But you know one thing, within this though, look, them nails is done. Okay? Them nails is pretty and done. I'm like, come on now. Them nails is done. All that growth. And the nails are done. So you got to change the insides, you guys. Detoxification, just getting crap out the body is so important. It's so majorly. Apple cider vinegar, cheers to you guys. It's so important. It's so important. It's so important. Like I said, if you do not like apple cider vinegar, you will gag and throw up. You will gag and throw straight up and out projectile-y drinking this. Because it's strong. But it's going to get in there and get, it's going to do what it needs to do. Okay? So, you guys, work on the health. Work on the health. I talk about this every day, and more every day people are dropping like flies, and I want you guys to think about that. Like, coming up, these holidays are coming up, and I've had a friend of mine who's going on 300 pounds he's going to lose weight. He has to have, now he's being told, you need hip replacement, knee replacement, all of that weight, all of that damage in those areas. And he says, Jan, the doctor says I gotta lose weight. I said, yeah, you do. I said, okay, I got something for you. I have something for you. I said, I have a jumpstart program with a GLP-1, semaglutide. I have that for you. I said, I have that for you. I have a jumpstart weight loss plan for you. It's very simple. It's inexpensive. It's only $175. You're not going to find that anywhere else. You are not for the quality, not getting me. And that's because I want to help you. I want to help so many. It's not about the profit from that. It is helping people at a affordable price, what they can do. That's so tiny. And he says, yes, no, it is, but I'm going to start in January because I know me, and the holidays coming up, I like going to Chicago and the my hot dogs in Chicago, and I know me, I'm not going to waste your time or my money because I'm not going to do it until. I said, okay. I said, first of all, I thank you for being honest. I do not agree with you, and being your friend of 28 years, I'm just telling you, God forbid that you make it to the holidays. You're still here for January. I said, I'm still here for you in January to start, but there are some people saying that same thing, and they're not going to make it to the beginning of the year. The heart is not going to last. It is not. It is going to shear with this. This will be the year. This last big meal, all this stuff that you're finna add on 10 to start in January. Well, I'm gonna start in January. Like I said, I pray for everybody's wellness. But there will be some people that will not be making it to the beginning of the year. They won't. They will be dropping before then. And I said, I don't want you to be one of them, you know. I mean, with having. Now, we all know that we don't know the time nor the hour, but I'm saying these things for people that have placed themselves in these high risk factors that hurt, because food is not like food anymore. The fat on you is not like fat of old. It is genetically designed to break you down, and it is. It's breaking you down from the inside. There are so many people now with having abdominal aneurysms, bursting. And somebody out there might know somebody that, yeah, that happened to such and such. So it is, you're bursting. You are, I just want people to just make a change. You know, like I say, every day we get two things, a chance and a choice. So we just got to start putting more emphasis on our choices while we still have a chance. That's it. So we've covered some urinary incontinence for ladies. Okay, that peeing on yourself, it's no good when you're looking all cute and you're like, ah, gotta go. Okay, so working on their holistic remedies for that is like 30 minutes in the office. Tighten it up, get a nice wand, you know, it's time. You know, ladies, live your best life, especially my girls 50 and up. You know, it's time. It is time. Treat yourself, because it's just time. Treat yourself. While you guys are, I don't know. You know, I just tell people, for people who think it's expensive to do health improvement things, like, I just say for people spend their money on what they want to spend it on. So if you make a choice to spend it on yourself and improve your wellness, that's amazing. That's amazing. If you don't, and you choose to spend it on the other things that bring you joy in life, that's amazing too, you know. To each his own. But for those of you who do need to make some changes, you know, you've been thinking about it, people have been telling you about it, and now you're forced because maybe a doctor has told you, oh, you got to make some changes. Now we're here. I'm sorry to come back in the room here, sir. What's the prognosis, doctor? Well, we got to give you about 24 meds, and we're going to see you in 3 months, and then we're going to add on 2 more. But you're going to be good. Okay, so some of you all out there are on so many meds that you don't need to be on. I just got a call today. A lady's like, Jenny, do you do men's health? I said, I look. That's my first look. Like, I really love men's health. Like, at the top, because I don't know if it's because they need so much help, because they're like babies and they need more pampering. They really, really do need more hand holding. So I'm going to say this with a nap. I'm going to hold your hand with a napkin in between when I say this, okay? Men, check on your health. Stop playing. Stop being a baby. Stop being scared. You haven't checked that prostate in forever. Get it checked. You haven't checked your testosterone, and you're wondering why you're so irritable and you can't get it. Like, you know, get yourself checked. Just check. Just make a call. Some of them don't. Well, I ain't being, nothing's been wrong. You don't know that. Just get some current lab work done. Just get a check. Okay, so that's for the men. Ladies, they take a little bit better care of themselves. They pay attention to themselves a little more. But for the ladies, some of these ladies, y'all need to stop just paying attention to your outside. All that bling, all that crap on the outside, your outside wear, your outside, the inside. Pay attention and change up that inside too. Okay, ladies? A lot of y'all walking around not paying attention to your sugar levels, to your diabetes, your hypertension, meds, you're taking them when you want to, all that stuff there. That's not good either, okay? But you got that hair done, you got the nails done, but you haven't picked up your blood pressure med in a while, you haven't taken it, you ain't thought about your diabetes. You're still eating and doing what you want. You're still gaining 50 pounds, but you got on your cute Chanel top in the bag, and you know you're on your Instagram, and you're gonna drop too, because the heart cannot take all of that. So put some of that same emphasis that you're putting on that outside into the inside, okay? And we're gonna have an apple cider vinegar toast to y'all too, okay? Cause stop it. I don't know. Ooh, just stop. Because if you think the cost of health or wellness is expensive, wait till you get the bill for illness. Wait till you get the bill for critical illness. Wait till you get that bill and you say, dang, I should have started back then. I should have made those changes back then. Don't do that. Okay. Y'all see Nene Leak's son? Y'all, did anybody see Nene Leak's son who just had a heart transplant? Is what I saw. He just had a heart transplant. 24 years old. 24 years old. I have to clap at that because I was like, 24 years old, a heart transplant, because he was diagnosed this summer, I saw in a report, with congestive heart failure. Okay, and I've seen him. I haven't watched the Basketball Wives probably since season 2, episode 1, I think. After episode 1, I didn't watch it much anymore. But I've seen them over the years, and I've seen her son, what was his name? Fred something. He's always been big, overweight, doing his thing, eating and doing his thing, living his life, risky lifestyle and all of that stuff. And that caught up with his heart. The heart was like, you done told me up. I can't do it. I can't. I'm tired. I'm weak. I'm tired. That just put a song in my head. But the heart is saying, I'm tired. I'm weak. You have stretched me. I have grown. Everybody out there carrying around 200 pounds or more, don't think your heart has not enlarged, because you are walking. You do have. It causes enlargement. Trying to beat and trying to work for all of that excess. So that enlarged heart that's not able to function fully, then you got it all. It's all congested. So he got a heart transplant. He was forced to get a heart transplant. And you know what he's forced to do now? Do you know what he's forced to do now after the heart transplant? Everything he should have done before needing a heart transplant. So please take that to heart. Some of you are all walking around out here in that same freaking condition. Now after the heart transplant, okay? Look at his discharge. Don't do that. Make sure you exercise. Make sure you're eating right. Make sure you're getting rest. Make sure you're sleeping. Make sure your mental stuff, low stress. He's only 24 years old, but in total, he got to do now all the stuff he should have done before needing a heart transplant. Okay, and another good point with that is, if his mama was not Nene Leakes and have Nene Leakes money, I was like, how that dude get a heart transplant this fast? Do you know how many people are on the heart transplant list? And if they're regular like you and me, do you think in a few months you get a new heart? I don't think so. I was like, oh, his mama is able to get him a heart, which kind of makes me go back to, I have my feelings of these stories where we hear people, all these people that come up missing with no organs and no parts, and we hear about the black market and organ sales. I think that really put in my head, I don't know why, but it put in my head, oh, they went and bought one. They went and bought a quick one. They went and bought a quick heart, because I think there are private markets going on now with that or something. It has to be. How do you get a heart transplant that fast? But you do. So for the average ones out there who don't have Nene Leakes money, who are now being diagnosed, you're in congestive heart failure, and you've got to make these changes. You're on the list. Start turning it around. Start turning it around before you get there, okay? I just had my weight loss client. He's so happy. He sent me a note saying, I'm down 21 pounds. He's now down to 419. He feels like a new man with that 20 coming off. And we're going to work it all the way back down some. You can't keep going, and you feel it. And somebody out there sitting there like, she's right. I feel it. I'm tired of being tired. This weight is pulling on me. It's causing. Oh wait. Okay, I'm gonna have to hang up because I'm running out of power. But it's causing so many people know with respiratory problems from their weight. Respiratory problems. You got to get CPAP machines at night, sleep apnea machines at night, inhalers. Come on now. The body wants to heal itself. It wants to be whole. Okay, I got apple cider vinegar to y'all on it. For real. All of that. Just make some changes, you guys. And some people, it's hard for them to. That's why I'm saying reach out and get help. There's so much assistance out here for you. Get help. Don't listen to your friends, your neighbors. Get the proper professional help, okay? Because it's no joke. It's just no joke. So, all right. I should have left to get something to eat. But I just want to come on and talk about that for a minute. Take my mind out of where it was. But yeah, so ladies, please let me know if you guys do happen to watch this video. I don't know if you watched to the end. I don't know how long I've even been talking. But you do want to know, I really want to have a little forum for only those ladies that are interested in that topic or that are going through urinary incontinence right now. You are 50 and up, that leaky bladder, and want to know about holistic solutions for that. That's what we're here for. If you want some more information on the wonderful things going on with Morpheus, tightening up the face, vaginal tightening, rejuvenation, all of that, okay? All of that, all these wonderful holistic natural things. No medicine, no pharmaceuticals, nothing. But like where? Okay, but for those who need a jump start, okay, this pharmaceutical you do need. And in a small, safe dose, let's turn things around, because it's turning lives around, and I'm so glad. I'm so glad, because we have to arm ourselves. You have to be your best protectant. You have to boost your immune system up. You have to boost everything up. Dang, look at my tight. Okay, my workout went good today. Okay, sorry. I feel like going back to the gym. Okay, I'm really ready to use some more of my firming cream. I have to put it on for the night. I did it this morning. It's twice a day. I put some on, go back to the gym. So that was a good workout today. Yeah, I need to start doing twos. I need an accountability partner. Anybody out there want to like pair up and do some accountability? Okay, because I don't like the gym. I don't. Although I've gone for years, I've never gotten into that space. Oh, I love the results, and I know that I need it for the health benefits. But that's it. But I've never gotten to the point where, you know, those people that get that endorphin high. They're like, I just love it. Oh, so good. No, I've never. I get there and I'll sit in the car for like 20 more minutes before I go in. I'll say, okay, I got to build myself up. Got to get in there. You do. I'll sit in the car and think of 10 things to do before walking in the door of the gym. And then I go in. Once I get in there, then I'm off. I'm good. But getting in there, that's a feat in itself. I've sat in the gym parking lot and then say, you know what? Let me go do this real quick. I'm going to come back. And I leave and I'm going to go back. And I said, why'd you even do that? Why? But that's the power of doing what we do, right? Or doing what we don't want to do. Or doing what we should do. Or not doing what we should do when we should do it. So that happens. And the consequences, you know, we choose to suffer them, right? So, yeah. Okay. Well, I think that's, I am like, oh my gosh. See, I'm on my iPad. Oh my gosh. Somebody's on there. Okay, well, hold on. I'm sorry. I'm on my iPad and it fades it's not like the phone. So there are no, I can see no comments on here. So please Por favor, forgive me if you said something or asked a question and I should be answering, but I can pull up the comments now and just see. Okay, why don't we do that, Nurse Jenny? Oh, I should have pressed the live chat. Sorry. Okay, sorry, real quick. Hey, Lawrence, how are you? Thank you, Robert. If you're still here, you might be gone. I'm not sure, but oh, it fades it out. It don't even keep it for long. I don't chat, live chat. All right, let me go fast because it looked like it's going to fade it like fast or something. I'm sorry, Robert. Thank you. Good. Oh, thank you. Really, thank you. I'm not feeling beautiful, but thank you so much. Thank you. I want a whole look or something. I don't know. Thank you. You're beautiful too. Thank you. Thank you. Thank you. You can see you've been playing a lot of Quincy. Oh my God, please! I can't even. You know, that's right. That's our era. Oh my God. Here in the garden. Woo! Ooh, don't take me to the garden, Robert. Dang, can I play that? Should we play a Quincy? Can we play a Quincy? Can we do a dedication? Will I get like a copyright or something? Hi, oh, Miss Kiss from Jay. There's a kiss from Jay. I used to keep saying kiss from K. Shout out to Kiss from Jay. And actually, you know what's funny? I should never always remember that now, because for those who know me on the street, Jay is my nickname, right? That's my nickname. So I know when somebody from the street call me, they be like, Jay. I'm like, who is that? So her name is Kiss from Jay. But I was saying the old commercial, there's a jeweler called K Jewelers. And the song says, a kiss from Kay. So when I saw her name, my mind went straight to that jeweler song. But then I was like, why do you keep saying a kiss from Kay? It's a kiss from Jay. I was like, oh my gosh, you got your name, your nickname. So thank you. Hi for popping in. She has a wonderful, amazing channel, you guys. I think she popped in to say hi. I love it. Or she's making up because she was shouting out like a bunch of people. And although like we have talked, you know, we have commented back and forth, I was just sitting there looking, waiting already for my shout out. You know, she did so good. I was like, I need to do that. I don't know how she did it, but she's a great editor and I have to learn the editing stuff. But at the end, she's so cute. It flashed up like the pictures of everybody that she's been commenting to. So I was like getting all ready. I was like, okay, your picture's gonna come up next. Okay, hold on, it's coming. I said, okay, it's in the next group. And then she got done, and I didn't even see my picture. I was like, oh, she missed me. I was so cute, and I wrote her. I was like, I didn't see me on your screen, but that's okay. I still love her. She's awesome, and she's growing. I love her. She does her videos from the car, you guys. It's so cute. But sometimes her car is stationary, but it bounces and it rocks. And I find myself doing like this when I'm watching her videos. And I would laugh to myself. I said, girl, she got me bouncing, rocking. I guess I just be into the video, right? My spirit just channels like I'm right there, like Lady of the Sea, riding her bike. I feel like I'm on the back of the bike with her. So with Kiss from Jay, like she'd be sitting there in her car, like be moving, and I'll be going like this. But I love it. She's really, really cute, and I think she does nails and aesthetics or something. But she's really, really cute. So thank you for popping in and say hi if you were like still here or around. I appreciate that so much. Lawrence. Okay, what do I recommend? Thank you, Justina. I'm so sorry. That was at 7:30 last time. What do you recommend for pregnant women to take for detoxification? For you, my dear, because the little bambino is muy precioso, muy precioso. I would, the most for you, infuse some things in your water, like your cucumbers. You can do ginger, I think with the baby, anything like that. Your cucumber, ginger, blueberries, a piece of fruit, slice of apple. Make some detoxification infused waters. I think you could even do some apple cider vinegar. You could probably minus the cayenne, might make the baby like, hey, estás calor en aquí, what are you drinking? They might not like that cayenne in there. Or they might like it, be like, hey, it's hot in here. It's getting hot in here. Okay? So I would recommend more of some infusing waters and help detox out. No specific teas or anything like that. Yeah, so keeping the baby good. All right, thank you. Bye. Thank you, guys. Oh, thank you. She's Lackey. I love your channel. I'm just loving everybody. Like I said, it's everybody has a piece of specialness. I just love when I've been thinking of something. That's why I'm like, this is just crazy. And I don't know if it's just higher enlightenment, but how? Sometimes I'm like, okay, is it the bots? They put nanos in everything. Is it the nanos? But no, it's just God. Because I could be thinking of a question in my head. Just thinking, didn't talk it out loud, didn't talk it on the phone, didn't share with anyone. And then I go to YouTube and I press on a subscriber's feed. And that video is answering the question I said in my head. And that's happened like numerous times. And it's so, I'm at the very video, and I don't necessarily go to other people's, their channel and like pick out the first video or something. I go where the spirit leads me and I'll pick it up. And there are times it doesn't even have what I was thinking in the title. I just pick on it. But in their video, it ends up answering, it manages to answer that question. So I'm just loving it. I'm here for it, all of it. So shout out to everybody, all of the new subbies and those that are continuing to stay with me, helping us grow together. I do try to just interact. I'm looking at all of y'all channels and getting on there and replying with my honest replies and my added girls for you. And even my, are you sure about that? No, who was that? Oh, that was that Kate? Oh no, one young lady, Nicole, and she has 2 channels. So someone on there commented that she should change the niche of one of the channels because one of her channels was natural hair. And somebody was commenting that, that's an oversaturated niche. You need to change it to something else because, and now, it's too many large scale people doing it. And it instantly brought to my mind, the comparison of Victoria's Secret and Rihanna, and you've heard people say that, like, so what? The lingerie field, super saturated. How ginormous is Victoria's Secret? And Rihanna, that didn't stop her from saying, well, I'm going to do lingerie too. So I think still in this world we're in, it's enough of everything for everybody because there's so many people, billions of people worldwide that you can end up having amazing access to. So yeah, so I commented on her comment that, what did I say? But it was along the lines of she don't have to change her niche because it's still enough for everybody, and there's still people that haven't seen some natural channels because she was trying to make the point that everybody goes to every natural channel, and no, they don't. I'm still amazed when I see some natural hair channels. I still stop and watch because I love natural hair stuff. I still love doing mine, even though she might be right. One day I noticed one of my natural hair things that I did, I think it just got like 6 views or something. It was tiny, and I said, oh, okay. They're not feeling a natural hair. They want to hear about urinary incontinence or what else you guys like. I talk about something else, but my little health related stuff. I was like, okay, but I like my natural hair, so I'm gonna still do natural hair videos. I do. It's what I enjoy, so I'll still put them out there. Whether somebody might say, oh, you know what? I hadn't seen anybody do that style. That's what the lady's gonna see. She said every natural style that has been done, and it's on a video with somebody doing it. So just change your niche. And she was like, no, thank you, but thank you for commenting. So she was so nice. So I love that about you guys. I love the personability. I just love everybody that I have connected with. That's all. I don't know about the people I haven't connected with, But I know about the ones I have connected with, and every one of them is just fabulous. Muy fabuloso. Okay? Alright, this little nappy hair girl is gonna go then and get something to eat and continue doing my tasks to personal freedom. Yeah. Alright, so thank you for staying with me and hanging out. I love it, I love it, I love it. Love you guys. And bye. Duh.